In recent days, there's been an important intervention by Brisbane-based paediatrician Dylan Wilson, who wants to see an immediate moratorium on puberty blockers and cross-sex hormones prescribed to children. He wrote to Queensland medical authorities. I'll put some of that detail up on the screen, but he's sort of saying that there's been so much evolution in clinical practice, Australia needs to just pause for a moment, look at the evidence and then decide if this is what we want to proceed with. Well, right out of the gate, Queensland Health dismissed his concerns, arguing that what they do is evidence-based, but that doesn't accord with what we know overseas, particularly with the Tavistock Centre in the UK. Joining me now, Dr Philip Morris, President of the National Association of Practising Psychiatrists. Dr Morris, welcome to your program, to my program. Why is this intervention from Wilson so important, and why were so many medical bureaucrats quick to dismiss him?
Well, it's important because the doctor is a paediatrician, and he looks after children and young people with this particular condition, and he knows a lot about it. And he's been looking at what's happening overseas, and of course what's happening overseas in countries in Scandinavia and the United Kingdom is that they're being very, very cautious now about using drugs called puberty blockers and cross-sex hormones for children under the age of 18. And in all those countries now, they've basically said that a child or an adolescent should not go onto these drugs unless they're in a properly controlled clinical trial. Now, that's very different to what's happening in Australia, where it's much, much more easy to get children onto these drugs through gender clinics and through private doctors. And they're not going into clinical trials the way that the UK and the Scandinavian countries have now decided that they need to, because they need to be much more cautious than before.
So why are we not taking on board what's happening overseas?
Well, I don't know. I think there's very much, it's a polarised area of medicine. There are those who are very pro the use of these drugs in young people who are questioning their gender. There are others who say that we need to be a lot more cautious. I mean, it's such an important thing when a child or an adolescent comes along and says they're totally questioning the gender compared to the sex that they have, and they want to have a doctor treat them with drugs that may not be that effective, but definitely have serious side effects. And for a doctor to be in that situation, they need to be very careful. And one of the things they have to do is to really look at the assessment of the individual, try and identify what's bringing them forward at that time. And so doctors have to make a diagnosis, but they have to make a differential diagnosis and identify what other things might be causing this before they choose to put a child or an adolescent on drugs that are likely to change them forever.
We saw that with the Tavistock inquiry, right? There was a lot of complex issues that went into kids with gender dysphoria. I guess the problem is we have this policy now in a lot of medical areas that you must affirm their choice, as opposed to saying, look, is there something else behind it?
Well, that's right. You see, the National Association of Practising Psychiatrists, we've put out a guide that says people, and particularly the doctors, need to look into this much, much more closely and identify what other things are behind the presentation of the child. Now, sometimes it'll mean that the child and the adolescent will go on to receive hormones, but we're saying we need to be very cautious about that. And we've put out a guide which is different to the affirmation guide. It's a cautious guide. It certainly respects the child. It's compassionate, and it's available and it's published on our website. So if people just go to napp.org.au, they'll see the guide there. And this offers doctors another way of dealing with this particular clinical condition, and we think this is the best way forward.
Dr Morris, thank you for your time. This is such an important issue.